Hi, this is Jill Ryan of Courtemanche Associates with the 7th in our series of top findings from Joint Commission surveys to date this year. And this one is related to a significant patient safety concern, and it's scored under the provision of care related to resuscitation services being available or not in the case of these findings, where needed and when needed. So some examples from actual survey reports include, in the C-section rooms, there was no crash cart available for immediate use and no evidence of documentation that a risk assessment had been done to negate the need for a crash cart in that area. On tour, an AED was noted to be located in the hallway. The hospital policy states that all defibrillators are to be checked daily. The AED was being checked monthly. And another note here, while not always scored under this PC finding, we also see an increase in focus on the availability of malignant hyperthermia carts. And so what are some tips we can do to address this issue and certainly avoid this RFI? We'd encourage you to consider conducting risk assessments to determine the need for code carts and malignant hyperthermia carts, pediatric equipment perhaps, where pediatric populations are served. Where are we housing and seeing patients? What is the distance between code carts that might be shared amongst units? Good way to assess for that is to actually drill how long it takes to get from the patient care area to the code cart and back to the patient. Is that acceptable in terms of a code response? And that risk assessment will either justify the need and therefore the expense for the cart, the emergency medications, et cetera, or document that the risk assessment had been done and based on good evidence and your drills and whatever other processes you employ, that placement of emergency equipment was not warranted in that area. So again, this is certainly a significant patient safety issue, one that should be assessed in all organizations, and certainly one that's getting increasing attention during survey activity. We hope that you are continuing to benefit from the tips that we are sharing. We have several more over the course of the next several months and look forward to your continued participation and any feedback that you might have. Please don't hesitate to reach out to us. Thank you very much and have a wonderful day.